Okay, so before we get started, I'm just going to confirm some information from your chart and ask you a couple questions.
Okay.
So first, I see here in your medical history, you were diagnosed with Lennox-Gastaut syndrome at age 4, is that correct?
Yeah, that's correct.
And that had some associated symptoms of seizures and difficulty swallowing, and that's persisted for a while.
Yeah, my whole life.
Okay. And you had a seizure 2 months ago, correct?
Yeah, I did. In, let's see, May.
Okay. Can you tell me about how your problem has changed since that most recent seizure?
I just feel like my swallow has gotten a lot more painful. I noticed that it's really hard to swallow water in particular, and my saliva hurts too.
Okay, so dry swallows and swallows with liquids are painful.
Super, yeah.
Okay, and what about eating?
Eating's okay. It's hard to wash it down, but the food itself isn't really a problem.
Okay, so we're getting a full diet, but definitely washing it down, being hydrated is a problem.
I do feel pretty dehydrated these days.
And can you tell me, just to confirm, the medications you're on to manage your seizures?
Yes, I'm on lacosamide as well as clobazam.
Okay, do you experience any side effects?
Mostly just drowsiness, but I do notice that my mouth gets super dry.
Okay, so that dry mouth is definitely going to contribute to that feeling of dehydration, difficulty swallowing, dry swallowing pills. Okay, thank you so much for sharing. And any other side effects?
No, just the pills are really hard to swallow as well, for sure.
All right. So, if you feel comfortable, we'll move on to an oral exam.
Okay, great.
All right. So I will have you pucker your lips for me. All right. Now make a big smile. Can you alternate between puckering and smiling? Okay, great. Now puff out your cheeks. All right. I'm going to apply pressure. I want you to try to hold the air in.
Okay.
Okay, great job. All right, now I want you to open your mouth as wide as you can. Right, can you open your mouth a little wider? Are you experiencing any discomfort?
It hurts.
Okay, so your jaw hurts a little bit, okay? Is it on both sides you're feeling that discomfort? Okay, so I'll have you stick your tongue out just as far as you can when you open your mouth.
Okay.
Okay. Can you elevate it towards your nose and hold it? All right, and then down towards your chin. Can you alternate between up and down? Okay, and then I'll have you go right to left with that tongue. Alternating side to side, good. And then hold it to the right, and then to the left. Great. All right, now can you open your mouth for me? Just gonna look at your teeth. Have you ever had any recent dental work done?
No.
Okay. And now I will have you say ah for as long as you can. I'm just going to time it. Go ahead. Okay, great, thank you so much. And now I'm just going to ask you to dry swallow with your saliva. I'm going to touch your neck and just feel the swallow go down, okay? So take your time.
Okay.
And all right, so now I'm just going to ask you to move your head and neck so that I can see the motion and strength there. First, I'll have you sit up as tall as you can with your shoulders back. Okay, now can you move your neck side to side like this? Okay, do you feel any discomfort when doing that?
No.
Okay, now all the way chin back and forward. Perfect. Okay, so we just filled out that form where I had you remember some words, do some counting, draw some pictures. How did that feel?
Easy.
Okay, good. I want to talk to you about that rating scale that we used, because that's going to help me make some recommendations that you're going to be able to do realistically. So I saw that in that rating scale, you rated that swallowing has become really stressful.
Yeah, especially with the liquids.
Okay, so swallowing liquids is very stressful and that it's impacting your ability to eat and drink socially.
Definitely. I feel like I stay home a lot more than I used to.
Okay. And that it's the liquids only that are making that effort.
I think so. The food hasn't been a big problem for me.
Okay.
Stop. Perfect. We're going to do the straw now. And stop. Okay, we're going to stop with the water now. How did that feel?
Better.
Take your time. Okay. Have you eat one half and then the other? One more. How'd that feel?
Better.
Better?
Good.